Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is December 4, 2025. This video is on a special New England Journal of Medicine article titled Updated Evidence for COVID-19 Respiratory Syncytial Virus or RSV and influenza vaccines for 2025 to 2026. It was published in this week's New England Journal of Medicine. Respiratory viruses, COVID-19, RSV, influenza remain major drivers of hospitalization in 2025 to 2026. Systematic review of 17,263 references, 511 studies were included. Populations, infants, children, adults, older adults, pregnant persons, and the immunocompromised. Primary outcomes, vaccine effectiveness against hospitalization. Safety events including myocarditis, Guillain-Barré syndrome, cerebral venous sinus thrombosis, and preterm birth. Databases used include PubMed, Medline, Embase, and Web of Science. Methods, randomized trials, cohort, case control trials, and other observational designs were included. Vaccine effective windows for COVID-19 within 6 months, for RSV and influenza within 1 season. Meta-analysis using random effects models, heterogeneity assessed with I-squared. Sample sizes up to 45.7 million adults in safety analysis, 3.7 million adolescents in myocarditis estimates. Bias assessment performed using validated tools. Greater than 50% of the studies had moderate to high risk patients. What did they find? COVID-19 mRNA vaccine effectiveness against hospitalization, 46 to 50% in adults, 56% in older adults. For the KP.2, vaccine effectiveness was 68%. For the respiratory syncytial virus, maternal vaccine effectiveness 68% for infant hospitalization. With nirsevimab, vaccine effectiveness was 79 to 83% in infants. In adults, the vaccine effectiveness was about 79%. Influenza vaccine effectiveness, 48% in adults between the ages of 18 to 64, 67% in children, 40 to 53% in older adults, varied by formulation. Safety, myocarditis was rare, 1 to 3 per 100,000 adolescent doses. RSV pre-F was associated with 18.2 excess GBS cases per million in older adults. Limitations of the study, heterogeneous designs, varying dominance of viral subvariants, high proportion of observational studies. Clinical pearls, longer dosing intervals reduce myocarditis risk after mRNA COVID-19 vaccination. Maternal RSV vaccination and nirsevimab show consistently high protection in infants. High-dose adjuvanted influenza vaccines yield better vaccine effectiveness in older adults. Safety profiles across all vaccines remain consistent with prior seasons. Co-administration evidence remains limited, but no major safety concerns identified. These are some eponyms related to this trial. Hit pause and view at your leisure. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.